Okay. I hope I'm audible and visible. A very good evening to all the pediatric residents. Some of you know me already, and many of us are interacting for the first time. I am Dr. Sandeep Sharma. I am the pediatrician. I've done my MBBS from 𝗗cie Shimla, and I've done my MD Pediatrics from PGI Chandigarh. Last more than a decade, I have been training students for various competitive exams, ranging from the PG entrance and FMG to super specialty entrance exam. And this is a special session, the first one, but certainly not the last one, where we are going to interact and we are going to discuss a lot of things together. So the purpose of this session for me is to see where you stand right now, what is this program all about, and how we are going to go about this program. I'll also be discussing about what are the residency related things that you should be careful about. And just a minute. I just got a message. More people are joining in. So I'm just waiting for a couple of minutes and then we can start.
Recording in progress.
Just a second. Okay. So, yes. Good evening. Good evening. Many of you are watching on the app and some of you are watching it on the YouTube right now. So I'll just start again. So I'm Dr. Sandeep Sharma. I'm the pediatric faculty, and this PG residency program is a very, very special program. There is a reason why this program we have planned in a way. The purpose of this entire program is to train you for the upcoming residency. Many of you are already doing your MD in various medical colleges. Some of you are doing DNB, and some of us are already finishing it off. So how is this residency program different from super specialty program? First of all, when you prepare for any super specialty program, your focus is on lectures, solving the MCQs, one-liner related points. That is where the entire focus is, right? But when it comes to a residency, it is going to be a much more detailed program. The objectives are very different. The objectives are basically to become a better clinician. The objectives are that you should know the history taking examination. You should have full confidence when you present a case. You should have full confidence in your ability to make the diagnosis appropriately. You should be updated with the latest information. Some of it, of course, will be useful for the entrance exam also. But majorly, this is related to your super specialty, majorly related to your residency program, right? So what we have done here is we have taken a team. So there are multiple players in this team. I am Dr. Sandeep Sharma. I will be generally overviewing the entire program. Along with this, I also have an eminent team of academicians. We have Dr. Aparna, who's a neonatologist. She has been my super senior at PGI. We also have Dr. Parag Dekate, who's a critical case specialist. Again, Dr. Parag has been my senior. He has been, very, very strict senior of mine. But of course, he's now a colleague of mine. And that is how residency days are usually, eventually you end up working together. And we have Dr. Sudeep Verma. Dr. Sudeep Verma, sir, is a practicing pediatric cardiologist at KIMS Hospital in Hyderabad. And plus we have a team of members who will be helping us in content creation. There will always be, we have also taken the help of Dr. Ragul, who will be helping us out with the pediatric surgery related topics, because as you will start reading, as you will start entering the intricacies of pediatrics, you would find that many pediatric surgical disorders we have very limited orientation about. So we have covered that aspect also. And Dr. 𝗙ecie is with us, who is a PSM specialist. She's a PSM faculty at Doctutorials. So for your biostatistics, for your health programs and related points, we will be taking the help of ma'am. So it's a complete well-knitted team. At the same time, some of you have already subscribed for the program, and many of you will be subscribing in the coming days. This live video will go up after suitable editing on the app also. So what is this program going to go about? If you look at the Doctutorials PG Residency app, when you open the app, there are you have to first select that you are subscribing for PG residency, then you have to choose pediatrics. And then in pediatrics, you will have two top tabs. One of them will be talking about the clinical cases. So, and one of them will be talking about the basics or the detailed videos. So in detailed videos, you will have all the major systems which will be covered. It will usually start with essentials. And in essentials, what are the books to read, how you should be taking history taking, what are the examination points we will be covering. About 66 plus videos have already been uploaded. There are some clinical cases also. What we are going to do over the next 1 month is we are going to take up all the system-wise history taking, system-wise examination. There will be case scenarios. There will be mock vivas. There will be help for you to, if you are tinkering with your thesis data right now. So in case there are any issues, then we will plan some biostatistics classes. And every weekend, this is just the beginning, this is just the beginning. If there is an IPL going on, so this is the opening ceremony of IPL where I'm, performing in front of you. So the real matches are going to happen immediately after this session is over. But it is important for you to understand that how we are going to go about in this program. And in this program, of course, we will be connecting every weekly. One of us will be coming. The detailed schedule will be shared with all of you shortly. Initially, we will be keeping it, very flexible. Later on, it will be subscriber only mode. You can connect with the faculty, number one. Number two, there will be academic session. I'll give you an example. Subsequent live sessions. It will be about 1.5 hour session in which 30-minute, 35-minute, we will be discussing something academically important to you related to history, examination, or an update. So you will be updated in real world. Secondly, we will also be taking up whatever doubts you people are having. So it is not just, we have recorded the lectures and given it to you and there is zero interaction. It is going to be the first dynamic program of residency in pediatrics in the country. Yes, because there is a new program. So we are also learning on the side and you are also learning. So we will be open to all the feedbacks. We will be open to whatever requirements you people are having. Suppose there are videos available and you ask me, sir, I am a couple of you or more than a couple of you are feeling difficulty in a particular area, we can definitely take it up. It is not possible to do it in a recorded session, in a recorded video, but in a live format, that flexibility will be there. All right. So this is how we are going to go about, and I hope all of you are going to benefit from it. I got some messages also, sir, I will not be able to join directly. You have duties going on, which is understandable. So this entire video will go up live. Now, second thing about the residency. How to approach residency? This is what I'm going to take up here. So if you are already joined someplace and if you are in first year, residency in pediatrics can be really challenging. It is like a cultural shock. It is like a, inside out. You have been maybe a student, you have worked before, but now you are dealing with young kids. The demands are high, the stakes are high, and you are expected to perform to the top of your ability. Plus, there will always be some toxic environment, toxic patients, and unfortunately, some of the academicians in medical colleges can also be a bit toxic. So this all toxicity adds up and creates a challenging environment for us. My dear friends, you need to understand that every single pediatrician that you see has gone through this. They have faced this scenario. Yes, this is not an ideal scenario, but this is what people before you have gone through. They have come out of it. And if you are facing difficult times right now, it is a phase. Many of you will adapt. Many of you will learn how to circumvent it. And most of you will use it for your advantage to bring that finesse, to bring that skill into your clinical learning. Because remember, suppose there is an adult coming to you and you just randomly say, give him, you are feeling shock is there, you randomly give him 1 bottle, 2 bottle of normal saline. It's okay in that adult, right? But in case of kids, a few ml extra will make the child go into pulmonary edema, whereas a few ml less will cause the child for shock to persist and sometimes to progress also. So the demands that are there, that is one of the reasons why first year is always challenging. First year, I think personally, I feel you should be devoting towards sampling. You should be devoting towards history taking, basic examination, critical care, emergencies, learning to do intubation, learning to do, if you are posted in specialty clinics, the various types of biopsies or helping out the forms, etc. Documentation is very important. All these things. And then, of course, you will be getting the thesis topic. So the entire first year will be taken up by this. In between, if you find some space, you can always put in a few academic points as well. Second thing, if you are in second year or third year, this is where the game actually begins, and you get some time to present the cases. You will be getting patients, and now you will have seniors below you. So you will be doing sampling, of course, but there will be somebody else also, doing it if you multiple people are posted, and so you will get some time to read. Do not try to think that you will get time to read cover to cover of Nelson or any Indian textbook. My advice to you will be, in the first year, go with clinical manuals. Harriet Lane and Drug Dosage by Dr. 𝗵𝗻𝗁𝗀𝗃 are excellent books to be added in the first year. There is a detailed video. It is a free video we have created. It is available on the PG Residency app, where I have told you pros and cons of various textbooks you should be reading, you should be using. So you can have a look at that also. And in case you are having any particular problem or particular individualized suggestion, you can always contact me. I will be available through the app also with you. So second thing is about Nelson. My dear friends, Nelson 22nd edition has been released in United States. In India, it is going to be available in a few weeks. So if you are already, if you have not bought the new Nelson, I would ask you to wait a few weeks and buy the new one. Yes, the hard copy, the international edition you're supposed to buy. There is a Southeast Asian edition also, but international edition is the most important one. There are subtle changes, subtle differences. Nelson 22nd edition, some of my friends, colleagues, and some of my juniors who are in US, through them, I was able to access the Nelson 22nd edition. There are some changes. The changes are mainly pertaining to the investigation and treatment part. So in case you are already reading Nelson, I would advise that you continue doing that. Whatever changes are there in this dynamic program, as I said, it is a dynamic residency program. So we will be taking it there as well. Right, so you need not worry on those aspects. Those points are also covered. Thirdly, some of you have subscribed, and we have got some, feedback saying, sir, videos are less. As you can well imagine, it is not a program where we have sat in a studio and just created out of it. That's too easy to do, and that is not something that you would be expecting as well. You need to understand that cases are there, cases take time. At the same time, there is a proper procedure to follow. You have to take consent from the patients, and not only from the patients. In younger children, you have to take from the parents as well. And there is a process we have to edit out and put it up. Having said that, the process is in full flow, and in the next few weeks, in fact, in the month of May itself, you should expect about close to 100 around cases, plus more cases every week will be added. And all these live sessions we are doing, they will also be added for the benefit of those of you who cannot attend live, and you can always ask the details later. And whatever updates keep happening, OPGHI 10th edition came last year. AIMS protocol, neonatal protocols got changed this year. It got expanded. There are 3 volumes now, volume 3. And the new Nelson, all the updates, the relevant updates, not all random things, but relevant updates we will be adding here as well. And if you are in final year, this program is going to be very beneficial, because you will be sitting in the university exam, proper way to present a history, proper way to do clinical examination, that we will be doing, that we will be discussing. There are, my purpose is, my purpose is, yes, you read a clinical manual. Multiple clinical manuals are there. Santosh Kumar is a good one. Aruchami Lakshmi Swami is a good one. Dr. Piyush Gupta's manual is a good one. 𝗵𝗻𝗁𝗀𝗃 is more for UGs, but you can also use it sometimes. But manuals can be time consuming, and many times multiple manuals, it will be difficult for you to correlate together. Some manual will have something, some will have something, and something will be left out. So we will be creating videos of these manuals, not of course copyrighted, based upon my experience, based upon my team's experience, how to do abdominal examination. What is the dipping technique? When you take a head circumference, where exactly the tape should be placed? When you're doing a Barlow test or Otto-Lani test, what are the key points that we miss? Where do you exactly place your thumb? See, reading it is different, but somebody trying to explain to you on the video as it is being done. This is what our aim is, and that is how we are recording the videos, and that is how the content is going to be available to you. So it is going to be like you have your companion in your journey towards being a good pediatrician. You have Nelson with you. You might be having one Indian textbook with you. You might be having a clinical manual with you. There will be a drug dosage book. We want that this fifth companion of yours should be this residency program. It will not be a replacement to anything. There can be no replacement to bedside teaching, but this will be good enough. This will be a helping hand. This will be a go-to thing where you feel that you want to ask somebody something. Your seniors are there, excellent. But academic things, you want to ask somebody who has time for that. This is that platform this residency program is going to provide with you. So we're going to be there with you. It's going to be a bit of hand-holding, but again, residency cannot be entirely hand-holding. It is not a replacement for your manual. It is not a replacement for any textbook. It is just going to, it is the aim of our entire team at Doctutorials Residency program is to make you better clinicians. And when I was doing residency, there were periods in my life I could not find help, academic help. So this platform will try to give you that academic help. So that is the whole purpose. That is the whole plan that I wanted to discuss with you. In case you have any other queries, you're most welcome to ask about it, and I will try to answer to the best of your abilities. So for those who have just joined, as I said, PG residency, whether you're doing MD or DNB, there will be subtle differences. Most of the DNBs will be in places where, compared to some MD, yes, there are DNB programs which are very extensive, but you will have slightly better time available to read, right? At the same time, there will be certain MD places where workload will be less. Ideally, first year should be devoted towards learning procedures, documentation, and critical care and newborn period. Second year and third year, more of bedside teaching is expected out of you. The faster you learn drug dosages, the faster you learn basic examination and basic emergency drug charting, the better it is for you. And third year is a part of it should be devoted towards your thesis submission, initial part, and then preparing for the exam also. And do not try to take shortcuts just from the beginning. Nelson has to be read. New Nelson is going to be out soon. So watch out for that. In case you have already recently bought the older Nelson, you can wait for the updates that we will be sharing here. And apart from that, that is all I had to discuss with you regarding this program for now. In case there are any doubts, I have multiple, things open in front of me. I have app also. I have YouTube link also. And I have the groups also open here. So whatever doubts, I'm just waiting for any of you. If you have any doubts, you're most welcome to ask about it. Any doubts? Any deliberations? Anything you have to say? Okay, I just got the message. Sir, I have already subscribed for the program, and some of the videos I have done, but since I started early, would I get consolation? Yes, of course. Yes, of course. Absolutely. See, if you have already subscribed the program, there is absolutely no reason you need to be. I've just got this message on my WhatsApp. So there is no reason why you should feel that, you have subscribed too early. As I said, it takes time, and the program is currently in full flow. Very soon, in the month of May itself, you're going to get loads of content. And in case you feel that the exam is just around the corner and you subscribed early and it is going to end a few days before your actual exam, as I said, I am there as a part of this program. I'm just a message or a phone call away. We at Doctutorials will make sure that there is no such problem to you. At the same time, if you like the content, you can also recommend it to your seniors and to your batchmates and to your juniors as well, right? So as I said, it is a program to help you in your residency. Would it be important for super specialty? This is the second message I've got on my Instagram. Yes, it will be. But would this program be the replacement for other super specialty programs? No. Am I going to teach you, how to crack MCQs through this program? No. See, if there is an MCQ on update on IAP 2023 guidelines on obesity in children, yes. If you listen to the update video which I have put up, and then you try to crack the exam, try to solve the MCQ there, it is going to be useful. But I'm not going to tell you, these are the MCQ points from this topic that you should be reading. So you need to, horses for the courses, right? And this is why this is a separate program. The aim is to make you a better clinician, to simplify your life in residency, to give you an alternate platform to connect, to learn, history taking, examination, viva, drug marking, newborn assessment, latest updates, Nelson updates, AAP updates, and live sessions for doubt clearing. That is what the aim of this entire program is. I hope it is clear to most of you how it is going to be there. And I'm just waiting in case there are no more doubts. You can let me know in case there are any doubts related to anything. In case you're not typing, you don't want to type it here, or you don't have the access right now, you can always message me. This video will go up on the YouTube also, and this video will be available on the program app also after editing. And I'm just a few, messages away. You can message me on WhatsApp, you can message me on Instagram as well, right? So this is the whole purpose of the program. I hope all of you do well. So the detailed program, the academic program of the upcoming schedule, which will not be an orientation kind of thing. There will be academic sessions starting from the next weekend onwards. That will be made available to you very shortly. In fact, it should be available to you by tomorrow itself, right? So let's make learning better. Let's make pediatric learning better today. Thank you so much. Thank you for connecting.